Is she evil? Yes, she's evil.
Oh, Lucy, is it?
She is Britain's worst child serial killer. She will die in prison.
The nurse Lucy Letby has been found guilty of murdering 7 babies.
Will die in jail.
The judge labelled her crimes truly horrific.
There was a deep malevolence bordering on sadism.
Death followed Lucy Letby around. She was looking for an opportunity to kill them.
Talk about Lucy Letby, you go down a rabbit hole of conspiracy theory.
On one side, those who are certain Lucy Letby is a serial killer. But equally strident are those convinced she committed no crime at all.
I have never known anything like it. There's no direct evidence. No one saw her do anything wrong.
Probably going to be the biggest miscarriage of justice.
All the convictions are unsafe.
I think she will be exonerated.
You're not overblowing this, are you?
She is as guilty as sin.
Lucy Letby, a name that shocked the UK. On the outside, she was this quiet, nerdy, beige kind of girl, like the type of person you wouldn't notice in a crowd. But in 2023, she was convicted of murdering 7 babies and attempting to murder 15 more, all between 2015 and 2016. It was a crime so unthinkable, she became known as Britain's most prolific child serial killer in modern history. But here's the twist. Recently, new evidence has come out and expert reviews are suggesting that Lucy Letby might actually be innocent. Hi guys, I'm Darcy and this is my new channel, Mind Behind the Madness. This case is messy, controversial, confusing, so what better way to start the channel? Today we're diving into Lucy Letby. Let's get into it. Lucy was born on the 4th of January 1990 in Hereford, England. Her dad was a future salesman and her mum was an accounts clerk, and her childhood was normal. Her parents devoted themselves to her since she was their only child, and she had her whole life mapped out. She told friends at school that she wanted to be a nurse for sick babies because she had a very traumatic and difficult birth herself, and so she wanted to give back to other families and ensure that they had the same outcome. And honestly, a lot of her friends were jealous because she knew exactly what she wanted to do, while they were still wondering, what am I going to do with my life when I finish school? She became the first in her family to go to university and she studied nursing at Chester University. She did a few placements at Liverpool Hospital and Chester Hospital, but she did actually fail her first placement. After demanding a new assessor, she retook it and finally passed. However, the first assessor that originally failed Lucy later reported that she didn't have medical knowledge and she wasn't very good at picking up on parents' nonverbal cues. You know, like when parents are in grief or they're distressed, she'd just be in their space.
So relaying the information to my husband literally of what the doctor had told me that morning, of him, how he was getting on. She wasn't actually ACE's nurse, she was covering somebody's break, overheard our conversation and felt the need to come over and tell us that I'm sorry I overhearing the conversation, but I don't like parents getting, their hopes up too much because you never quite know what could happen. I absolutely erupted and was like furious, like how dare you take that hope away from me? And then as a professional, I'm saying to the matron and to herself that it was completely inappropriate to take somebody. You can't speak to people like that because everyone needs hope.
And she also reported that Lucy was cold, which is brutal. Still, Lucy graduated and eventually landed her dream role at the Countess of Chester Hospital in 2012. Quickly, she became known as the poster girl nurse of the ward, and her personality spread throughout. She was kind, caring, and dedicated to her job. Staff observed her to enjoy watching the baby's progress and making the families happy, and she even joined a fundraising campaign for new equipment on that ward. But there were some red flags. It was very well known that Lucy only wanted to take care of the sickest babies and would often call the healthy ones boring. I mean, they're babies. In 2013, the first major incident occurred. Lucy and a senior nurse accidentally gave a baby 10 times the recommended dose of morphine. 10 times. I mean, I don't know how you'd do that accidentally, but That's what they say. Now, you could say it was the senior nurse's fault and not Lucy's because, you know, she was a senior and Lucy was relatively new. But when we take into account what happens eventually, it doesn't look great. Both were suspended from giving controlled drugs to babies, and, you know, Lucy was very upset about that, complained to the manager and said that everything was blown out of proportion. However, she did undergo some extra training, and in 2015 she was qualified to take care of sick babies in the intensive unit, which was her dream. And that's when things started happening. So here's the thing, this neonatal unit in Chester only saw maybe 2 or 3 deaths a year. But from June 2015 and June 2016, coincidentally, the dates that Lucy worked there, they saw 11 deaths, which doesn't seem that big in the great scheme of things, but considering that they rarely see deaths on that ward, it's a lot for 1 year, and they were happening in relatively quick succession, as you'll see. Before I begin with the timeline of events, I just want to note that the infants in this case are using initials for confidentiality reasons, and I also want to say that all of these babies in this case were reported as healthy, so I don't keep repeating myself. So yeah, let's start. On the 8th of June 2015, child A was given to Lucy on her night shift, but within 90 minutes he was dead. Lucy claimed that this baby had died from an infection. Lucy then went home that night and searched up the mother's Facebook page, but she did tell a colleague the next day that taking the baby to the mortuary was one of the hardest things she's ever had to do. The very next day, the baby's twin sister, child B, also collapsed. However, she did survive, thankfully, and Lucy again went home that night and searched up the mother's Facebook profile. 3 days later, Lucy contacted the unit manager and requested more shifts in the neonatal unit, saying that she didn't just want to be on the nursery. When this was rejected, she had a heated text exchange with one of her colleagues, basically complaining about the situation. On the 14th of June, when child C's alarm started sounding, I'm not sure if it was a nurse or a paediatrician, but they rushed in to find Lucy standing over the baby, not doing anything. Now, she did claim that he had just started collapsing, but when the doctors came in to try and resuscitate him, Lucy said, "He's going to die, isn't he?" And unfortunately, she was right. Lucy argued that the baby must have collapsed naturally because he was preterm. Following these deaths, Lucy texted a colleague saying, "I will keep ploughing on. I think there is an element of fate involved. There is a reason for everything." On the 22nd of June, child D collapsed twice in Lucy's care, and unfortunately, on the 3rd collapse, she sadly passed away. Again, Lucy said that the baby had an infection. At this point, a Dr. Brewery, the head consultant, began reviewing the deaths, and what he found was that Lucy was present at every single incident. But management said, coincidence, or words to that effect, because 4 deaths in the last few weeks wasn't suspicious. To be fair though, there was only 1 qualified junior nurse on the unit at this time, which isn't great, and Lucy was also taking extra shifts to cover staff shortages, which is also not great, but means that she's more likely to be on the unit and more likely to be present at these incidents. Now, the next incident happened around a month later, and this one is really horrific. Twin boys, E and F, had been making really great progress and were due to be transferred to another hospital, which was closer to home. So on the 4th of August, things were good. The boys were doing well, and the mum was returning to the ward when she suddenly heard this horrendous scream piercing through the corridors, and it sounded like it was coming from her child's room. She rushed over, and what she saw was nothing short of horrific. Lucy was standing over child E's incubator, the baby's mouth covered in fresh blood and in extreme pain.
In the corridor, I could immediately hear crying. I walked into the room, seen it was my boy. He had blood around his mouth, and Lucy was there, faffing about, not really doing anything. It's like, what's the matter with him? Lucy said, "Oh, don't worry." She has this really calm demeanour about her. Don't worry, the registrar was coming. She'd already contacted him. He was on his way. She told me to go back to the ward.
I was trying to reassure my wife that these people are experts, and, you know, if they say there's not a problem, you've got nothing to worry about.
2 hours later, child E was dead. He had lost more than a quarter of his blood, but Lucy claimed he might have had sepsis. After his death, Lucy bathed the baby one last time before returning him to his mum, and later sent a sympathy card to the family. Interestingly, straight away Lucy made a complaint regarding this baby, but it was concluded that the care was appropriate and that nothing could have changed the outcome. The next day, child E's twin brother F also collapsed, and the leg which had IV bag attached to it had significantly swollen. When the doctors changed his IV bag with a replacement, he continued to decline, and it was only when they removed the IV altogether that he started to make improvements. And luckily he survived. It turned out that while he was prescribed a small dose of insulin, his test results showed extremely high levels. Lucy insisted that there must have been accidental contamination, otherwise she couldn't explain why he had such high levels. The next infant, child G, was the most premature of all the babies in this case, being born 15 weeks early and weighing only 1 pound. But she was deemed healthy and making great progress. On her 100th day alive, a proud moment for her parents, she suddenly collapsed, and test results showed that she had too much milk in her system. However, she did survive. A few weeks later, on the 7th of September, she collapsed again. She was transferred to another hospital for treatment and survived again, the little trooper. However, the really heartbreaking part is that 5 days after she had returned to the hospital and back into Lucy's care, she collapsed again, and sadly, this left her with severe disabilities, specifically quadriplegic, cerebral palsy, and she was nil by mouth. Lucy claimed that she suffered from prematurity and possibly chronic illness. During this time, also on the 7th of September, when child G was taken to another hospital for treatment, child H also collapsed but survived. The next day she collapsed again, but survived. Lucy argued that this baby was suffering with chronic lung disease and an infection, which it was confirmed that child H did have an infection at some point, but she was treated and cleared for it by the time of the incident. Child I was the next infant to pass away suddenly on the 23rd of October. The court later described this particular case as a clear, persistent, cold-blooded and calculated murder. Her autopsy revealed that not only had she been force-fed too much milk, but that she also had air injected into her stomach 4 times, the last one unfortunately ending her life. Now, Lucy's defence was that she had necrotizing enterocolitis, aka serious bowel infection, and Lucy also sent this family a sympathy card on the day of the baby's funeral. It was at this point that Dr. Brewery, the guy who made the first complaint, said enough was enough, and rightly so, because, you know, there was a lot of deaths happening in a short period of time, whether it was related to Lucy or not. And his new review also found Lucy to be present at these incidents again. Another consultant, Dr. Jairam, also alerted management and complained about the rise in deaths, but was told not to make a fuss. Wow, okay. However, Brewery didn't give up, and he continued to investigate in February 2016. He requested an urgent meeting with the hospital executives, to which they said no, of course. And weirdly, the incidents had stopped at this point. Maybe coincidence, maybe because it was all being investigated. But eventually, the incidents did continue. On the 9th of April 2016, child L passed away, and his autopsy showed extremely high levels of insulin. It was also confirmed that Lucy herself had given this baby antibiotics, even though he wasn't prescribed them, and when they raised this to Lucy, she said that it was a minor error on her part. Oopsies. The same day, the twin brother, child M, suddenly suffered a life-threatening collapse and very nearly died, but survived. Sadly though, it was too late because he'd already developed significant brain damage and lifelong disabilities. It was at this point that Lucy was reassigned by her ward manager from night shifts to day shifts, and coincidentally, the incidents also moved from night to day. In May, Dr. Brewery was becoming increasingly frustrated that nothing was being done about the incidents, and during a meeting with other staff, he again raised the suspicion that Lucy was present at all the incidents, but he was informed that there was no evidence whatsoever to suggest that she had anything to do with the deaths and that this was all just one big coincidence. Now, child N was already born with a condition called haemophilia, which can cause severe bleeding. The prosecution later stated that this was the perfect cover for a child killer, because coincidentally again, his collapse was classified as the result of severe bleeding. However, his test results later showed that actually a nasogastric tube had been thrusted down his throat to cause trauma to the esophagus, but miraculously, the baby survived. Lucy then went on a 2-week holiday to Ibiza, lovely, and once she returned on the 23rd of June 2016, she was placed with triplets. As in all the cases, these babies were perfectly healthy and they were actually due to go home the same day. However, that didn't happen because child O suddenly died. 13 minutes later, child P also suddenly collapsed. However, the doctors were positive that he would make a full recovery, but they were going to send him to another hospital for treatment. And that's when Lucy turned to these doctors and said, "He's not going to leave here alive, is he?" And she was right. Child P sadly passed away the next day. Around this time, Lucy filed another complaint about intravenous medication not being available when she needed it, and therefore during one of the baby's collapses, she couldn't treat them in time. As per though, she was informed that everything was fine, but that all the nurses should be checking their equipment regularly so that this doesn't happen in the future. At the same time, Dr. Berry was also continuing to make complaints, and he asked the duty executive to remove Lucy from the unit. But did they listen? No, they never do. Well, I guess they did, because at some point Lucy was removed from the ward, but it still took a month. And after this new review, she was transferred to the patient experience team in July, and then later to the risk and patient safety office, where she remained up until her arrest. Now, the ward manager later reported that when she was transferred, she became extremely distressed and cried for a very long time.
She was devastated that they thought what they thought. She was broken. Cried regularly in my arms and in my office. And a mantra to me was, why are they doing this to me? I've done nothing wrong, Karen.
Now, after Lucy was transferred off this unit, there was an inspection by the Care Quality Commission. While they did identify issues with short staffing and skill mixes on the units, they did praise the overall positive culture and felt that the staff were well supported, and they didn't really see any concerns on the unit. And this probably added to the manager and executive's theory that it was all just a big coincidence. It wasn't until around September and October 2016 that another review was conducted, and they couldn't come up with a definitive explanation for why there was an increased mortality rate. Instead, they found insufficient staffing levels, like the Care Quality Commission said, and a shortage of senior nurses. But they praised Lucy's skills and they had no concerns with her at all. So due to not finding an answer for, these unexplained deaths, a neonatologist named Jane Horden was asked to carry out a more detailed case review, and unfortunately, she didn't have time for that, so she conducted a very brief, basic, and might I say pointless review. And she concluded that the deaths were caused by faulty leadership and timely interventions, so problems with staff shortages, basically. During these reviews, Lucy made another formal complaint about her transfer to the safety office. I mean, you would be annoyed because you're not really working as a nurse anymore, unless I'm getting confused what safety office means. And the chief executive actually apologised to Lucy and reinforced that their intentions were to protect her from all the allegations made, rather than blaming her for the deaths, and said that the doctors would be dealt with, whatever that means. However, it was only until March 2017 that the police were actually involved in the investigation, and staff had reinforced the police that sudden infant deaths and collapses were usually explainable, and why they felt that Lucy must have had something to do with it. However, this was actually later disproved in 2024 when a study in London found that over 50% of infant deaths were unexplainable. So basically their argument was BS. But still, it was a lot more than usual at this hospital. So after the police investigated and interviewed Lucy and staff and other witnesses, she was eventually arrested in July 2018 on suspicion of 7 murders and 15 attempted murders. She was bailed and then rearrested in 2019 and then bailed again and then rearrested for the final time in November 2020, where she remained. Now, Lucy denied all charges and insisted that she'd raised many complaints about the hospital's hygiene and staffing levels, but that no one had listened to her.
They told me that there would be a lot more deaths and that I'd been linked to somebody that was there for a lot of them.
Did you have any concerns that there was a rise in the mortality rate?
Yes.
Okay, so tell me about that. What concerns did you have?
I think we'd all just noticed as a team in general, the nurse and staff, that this was a rise compared to previous years.
But at Manchester Crown Court, Lucy was found guilty in August 2023 and sentenced to life in prison. So we have the supposed timeline of events now, but let's go through all the evidence and what made her seem guilty beyond reasonable doubt. So firstly, the way you present in court can be huge for a jury, and Lucy wasn't presenting well. Apparently, from the get-go, she looked cold and emotionless and would stare blankly from her dock while horrific testimonies were read out. It was almost like she didn't care. Meanwhile, everyone else in the courtroom was struggling to listen and finding the whole thing distressing. It was actually 16 weeks into the trial that Lucy showed any emotion, and it wasn't for the babies or the testimonies that were read out. It was actually because a doctor who she had allegedly had an affair with, who was married, testified against her.
Her thinking is evil, it's not psychotic. And so if she's craving attention, she's working in a hospital, she wants the attention of the doctor, and he gives it to her. So it's very reinforcing.
She knew him well, and she also knew he would be one of the first to be called whenever there was an emergency in the neonatal unit.
Now, I'm not sure on the details for this, but when the doctor testified against her, Lucy actually stood up and tried to leave the courtroom. But in my opinion, Lucy's apparent emotionlessness, if that's a word, and cold behaviour could be dissociation. If you're innocent and you're being convicted of being Britain's worst child serial killer and losing your job and, everything basically falling apart, you're going to dissociate. But to then have someone that you possibly loved, we don't know, but at least trusted and was close to, then testify against you, that's like the cherry on top, basically. So, it's not great. Anyway, there was a lot of evidence against Lucy, hence why she was found guilty, but there were 4 main findings that contributed to this conviction. These were a shift chart, some post-it notes, blood tests, and medical evidence. So, the shift chart. When you look at it, you can see that Lucy was on duty for every single incident, while the other nurses weren't. This is quite damning evidence and one of the critical areas that actually swayed the jury. Then there's the blood tests that showed deliberate insulin poisoning. So in simple terms, for all of us that aren't nurses or doctors, insulin and a molecule called C-peptide are produced naturally in the body. C-peptide is created to help form the correct structure of insulin. So if you have low levels of C-peptide, it indicates that your body isn't producing enough insulin. Now, given that certain babies had very high levels of insulin but very low levels of C-peptide, it was concluded that the insulin must have come externally, aka deliberately put into the system. Next is the medical evidence, in which a doctor named Dewey Evans claimed it took him 10 minutes to analyse the details and conclude that the babies had been murdered.
Immediately, I think within 10 minutes or so of having a look at these notes, I felt, oh my God, this baby is the victim of inflicted injury.
So it took you 10 minutes to decide that this baby had been put in harm's way?
Yes. as far as I could tell straight away.
In particular, an X-ray showed what could only be air running parallel to the spine, indicating that air was purposefully injected into the body. Now, Lucy argued that one of the babies must have accidentally dislodged their breathing tube, which caused them to collapse. However, Dr. J-Ram, who I've mentioned before, said that he's never actually seen a neonatal baby ever do this on their own.
There's a 25-week gestation baby who wasn't kicking around, who wasn't vigorous. The only possibility was that that tube had to have been dislodged deliberately.
And finally, we have the post-it notes, which were found during a search of Lucy's home. On this note, Lucy had written things like, "I am evil, I did this, I killed them on purpose because I'm not good enough to care for them." Basically, what looked like handwritten confessions. And Lucy completely accepted that these were her notes, and that she did write those, and had nothing really to say about it. She also had a diary which contained the initials of the deceased babies and had marked them down on specific days, like their birthdays, when they were allegedly attacked, and when they died, which is kind of weird. Like I said, there was a lot of other evidence as well, but these were the main 4 findings that stood out to the jury. In terms of other findings, not only did Lucy contradict herself many times and then become very frustrated when questioned on it, her argument that she'd been making complaints prior to all of this were actually unnecessary complaints. For example, she'd complained that a specific resource wasn't available for a baby's collapse, which meant that they couldn't get treated in time, but this wasn't true according to other staff, and that the medicine she was referring to wasn't even needed for the incident she'd mentioned, and also wasn't routinely kept on the shelf because it wasn't often needed in general, which the prosecution suggested that Lucy was grasping at straws to find other reasons for all the incidents. Then we have her phone records, which showed that she'd searched 11 of the babies' families and made a total of 2,287 searches. That's a lot of searches, and she would usually make these searches after a baby had died, on their death anniversary, and on special holidays like Christmas. Lucy was also accused of falsifying timestamps on patient records, which the prosecution claimed that she was attempting to avoid being placed at the scene of incidents. Then we have the witness statements, in particular Child E, who was found to be screaming horrifically and had blood from his mouth. A paediatrician said that that sound has never previously been heard in neonates before, which is just horrific to think about. And then there was the fact that Lucy had a huge stash of records found in her home, 257 to be exact. Now, Lucy claimed that she would just forget to bin them, and in particular handover sheets she'd put in her pocket and then go home with them by accident, and other nurses unrelated to this case have said that that's true, especially if you work on night shifts and you've done a long night. You can forget to bin your handover sheets. However, when the police questioned her on this and said, you know, why didn't she get rid of them once she got home and found that she still had them, she said that because they're confidential records, you can't just bin them. But she had a paper shredder in her home, so she could have got rid of them, which is suspicious. To top it all off, the defence team said that they had medical experts to prove that Lucy was innocent in all of these incidents, yet they never brought any of them to the stand, which is really weird. So, like I said, this is a lot of evidence, but there was also compelling evidence to prove her innocence as well. Firstly, in terms of the post-it notes, Lucy and her defence team claimed that these were simply the outpourings of a woman in fear and despair. You know, she was dealing with unemployment, she was likely going to be locked away for the rest of her life, and the whole country thought she was a serial killer. Now, when you're told over and over again by a lot of people that you've done something, for example, murder these babies intentionally, you will eventually start to believe it. You know, words really can get to people, and this could simply have also been her starting to question her own practice and think, maybe I did do it intentionally. Because when you look at these notes in detail, you also see other statements like, help, why me? I haven't done anything wrong. I don't know if I killed them, maybe I did. When we look at it unbiased in this way and we take into account everything she's written, it does seem like she's just writing down all of her chaotic thoughts and trying to process everything and sort of reflect on the whole situation, which, if you were doing this intentionally, would you really be writing stuff like that? Possibly not. Then we have the fact that while they didn't have expert witnesses to testify, for the medical evidence, they did have a plumber. And this plumber claimed that the unit was having really bad plumbing issues and it meant that he had to come weekly to fix it, to the point where sewage was washing up into the sinks and causing infection. Now, this is really damning evidence to suggest that the whole ward was infected, and Lucy did claim that a lot of these babies died from infection. It was also confirmed that there'd been several cases of pneumonia on the ward. Sorry? Is that not damning evidence? Obviously this wasn't enough to set Lucy free, and it was only until a year after she'd been convicted and put away for life that new evidence came out. Really bad timing. Basically, this has all come about when a lawyer named Mark MacDonald took a look at all of the case notes and believed that Lucy might actually be innocent, so he decided to reopen the investigation and work on her behalf to get her out of prison. He spoke with a lot of new medical experts to get their point of view, and in particular he spoke to one of the authors of a study that was used by the prosecution. So the prosecution argued that this study had found that when air is injected into the veins, it causes specific marks on the skin. And these were the same marks that were present on the babies, basically confirming that they had been murdered. However, the author of this study, Dr. Lee, said that actually his paper was misunderstood and that the marks they'd referred to would only occur when air is injected into the artery, which was not proven and was also not mentioned. He then went on to say that if this specific death was wrongly explained to prove Lucy's guilt, then all of the other deaths could be too. So this sparked Mark MacDonald to set up a panel of 14 experts to look through all the evidence and report their results live. In summary, they concluded that all of the deaths were completely natural.
In summary, ladies and gentlemen, we did not find any murders. In all cases, death or injury were due to natural causes or just bad medical care.
So let's go through a few of their findings. Remember when I said that the blood tests showed very high levels of insulin and very low levels of C-peptide, indicating that the insulin came externally? Well, it turns out that the test they used was a very cheap, basic test that doesn't actually prove where these molecules come from. In fact, this test can't even be used to fire someone because the results should be taken with a grain of salt.
Medical laboratory is about quick, fast, cheap, fairly good tests. It is used because the doctor has a very short window to make a diagnosis, but they're not perfect. That kind of test was never meant to put somebody in prison. You would not strip a gold medal from an international athlete on an immunoassay. It's not good enough for drug testing for pilots. So if it's not good enough to fire them, how can it be good enough to put someone in prison?
So because this test couldn't tell where the molecules came from, it looked deliberate. However, it's important to note that apparently babies have a specific natural antibody in their blood, and when insulin is created, it often sticks to these antibodies and stays in the bloodstream for longer.
Because the antibody binds to the insulin doesn't remove from the body, and the level of insulin bound to the antibody goes up and up and up and up in the bloodstream. It doesn't have any effect on the child at all. It just floats around. And as a result, it gives a very high reading on the particular test that was used. So what was presented in court as this is smoking gun evidence of poisoning actually looks pretty typical for a preterm neonate.
And that's what the blood tests should have shown, and did when Mark MacDonald requested a new proper test. So basically, these test results showed that it was completely natural levels of insulin. Next, we have the breathing tube situation. So remember when I mentioned Dr. Jairam say that neonates can't accidentally dislodge their breathing tube? Well, firstly, he's not a neonatologist, so he really shouldn't be saying anything at all. But secondly, it's not true apparently. Now, Dr. Taylor, an actual neonatologist expert with 30 years of experience, proved that neonates are very capable of dislodging their tube.
Accidental dislodgement is extremely common, and it can be dislodged quite easily by the operator, and it can also be dislodged by the baby themselves just by moving their head or thrusting their tongue, and suddenly it's not in anymore. The movement only has to be relatively small, so you're out by 1 centimetre, then suddenly the baby is extubated. It doesn't make sense to me. I mean, we've all seen it frequently.
In addition to all this, the panel identified that this infant collapsed because he was actually fitted with the wrong size tube by a consultant who clearly didn't know what he was doing. Brutal. Then we have the fact that a few of these medical experts on the prosecution side actually contradicted themselves multiple times. We have Dr. Jairam, again, who stated that one of the baby's collapses should have set the alarm off, but didn't. But when they arrived, they found Lucy to be standing there doing absolutely nothing and hadn't actually called for help at all.
That is a night that is etched on my memory and will be in my nightmares forever. Part of me was saying, you better go in and just check everything's okay, because you know what's happened before when Lucy's been on duty. Could see on the monitors that the oxygen saturations were dropping, and they dropped to a level that the nurse would have called for help. And Lucy Letby was standing by the top of the incubator.
What was she doing then?
Well, she was just standing there.
However, in 2017, emails were found from Jairam showing that he literally wrote down that Lucy had called him in for help. So she did ask for help. And then we have Dr. Dewey Evans, who was the main expert on the prosecution side, who proved that the deaths were purposeful. But he has now since changed his diagnosis. He originally claimed that Lucy had injected air into the stomach of a baby, which was proven by that x-ray. However, he now claims that air was actually injected into the veins, not the stomach, which caused an air embolism. Okay, so which one is it then? Mark MacDonald, the new defence lawyer, said if he's the lead expert in this case and clearly has no idea how one of the babies died, then none of these convictions are reliable anymore. Also, hilariously, Lucy wasn't even on shift for this particular baby when this air was apparently injected into his system. So the prosecution also argued that one of the babies was allegedly attacked by insulin poisoning in their IV bag, and that she had also poisoned the replacement bag, explaining why when the doctors changed his feeding bag, he continued to decline. However, these feeding bags that we're talking about were stored together in a cupboard. That would mean that Lucy would have had to trust that the next nurse that took over from her would not only go into that storage cupboard and pick out that exact replacement bag that she poisoned, but also give it to the exact child that she was poisoning in the first place. The likelihood is very low. And then lastly, and I think a huge point, is the shift chart I mentioned. You know, the one where Lucy was present at all of the incidents. Well, whoever made this chart forgot to include 6 other deaths on the unit, which Lucy wasn't present for.
This has influenced a lot of people. It's clear that this is aimed to present a conclusion. There is no explanation for the events that were left out. So really all this is telling us is that Letby was there. That can only be described as grossly misleading.
This is known as the Texan sharpshooter fallacy. Basically, if you selectively pick incidents where Lucy was present for, the data's going to look suspicious. But if you included all the incidents regardless of whether Lucy was there or not, it's not going to look as suspicious. You know, you'd get the same results if you did this with another nurse. Maybe one nurse was present for 7 of the incidents, and if you just included those, it looks like she's accountable. And this wasn't mentioned in court either. Now, A jury, especially if they don't know medicine or nursing, are always going to find someone guilty if a medical expert is claiming this means this, because I say so. You can make any data look bad if you play around with the stats, like the shift charts. And since this chart has been, you know, remade via Mark McDonald's requests, Lucy doesn't look as suspicious as the one that was used in court. Overall, many medical experts and the new defence team claimed that all of the evidence was incomplete and misled. They believed that the neonatal unit was taking more babies than they could handle, especially when they were short-staffed. You know, these babies are extremely vulnerable, and while they were considered healthy, are still very fragile. So if you're dealing with short staffing and possibly poor hospital care, or, like the plumber said, plumbing issues and likely infections, then you're just making it less likely for these babies to survive. I really just don't know what to believe. You know, all of the evidence I've mentioned can be directed for and against, you know, especially when experts and witness testimonies keep changing. It just all feels a bit incomplete. It's a difficult case, and because it is all mainly medical evidence, we have to rely on experts' testimonies, and half of them are saying she's guilty and half of them are saying she's innocent. Either way though, since this new evidence has come out, the Crown prosecution has still rejected it and said that the trial was fair and suitable. So basically said that none of this new evidence is useful, which I find kind of shocking, to be honest, because I feel like that's quite compelling evidence. Instead, they've reported that they've actually found more evidence to convict Lucy from not only Chester Hospital but also Liverpool Hospital, where she did one of her placements. And Dr. Dewey Evans, who I mentioned, has actually come forward and replied to the panel of 14 experts, saying that there was a significant amount of factual error and that everything they've said is trial by speculation. But the thing that gets me about all of this is why? If she's guilty, why would she do this? You know, people aren't born evil, no matter what anyone says. They're just not. You know, a lot of research shows that we learn through our environments, our childhood, and Lucy had a good one. You know, she had parents that loved her, she had a normal upbringing, she landed her dream job. So what would cause Lucy to not only become a killer, but one of the worst child serial killers in modern history in the UK? It doesn't make any sense to me, but it's just a really interesting situation, and you know, new evidence is coming out and Mark McDonald is still working on this case and trying to get her out. But what do you guys think? Do you think she's innocent or guilty? Let me know in the comments below, and I will see you in my next video.